Learning objectives at the end of the lecture. Students should be able to recognize humerus, describe features of different parts of humerus, mention key features, know the site determination of bone or humerus, and clinical anatomy of humerus. Humerus osteology. The humerus is the longest and largest bone of upper extremity. As a normal typical bone, it has a shaft and two ends, upper end and lower end. Humerus articulates with scapula at its upper end to form shoulder joint, and it articulates with at the lower end with the radius and ulna. This is radius laterally and medially is ulna to form elbow joint. First we will discuss upper end. In the upper end, head, which is rounded. As you can see, this is a rounded head. Directed medially. As you can see, it is directed medially. Upward, it is upward. And backward. As you can see, this is slightly towards the back side. Articulates with the glenoid cavity. This is the glenoid cavity of scapula to form shoulder joint. This is rounded head of the humerus, and this is glenoid cavity, and they will articulate with each other and form shoulder joint. Anatomical neck. Anatomical neck, as you can see, this line, black line, this is head. This line separating head from the rest of the upper end. This is the upper end of the bone. We are discussing upper end, and the head and rest of the upper end is separated by a line. That is the line, sort of line of demarcation in between the head and rest of the upper end. This is head, rounded head. This is the outer margin of the rounded upper head. This is called as the anatomical neck. This is the anatomical neck of the humerus. Now it indicates the line of attachment of capsule of shoulder joint. As you can see, this is the capsule of shoulder joint, and this capsule of shoulder joint is attached to the anatomical neck of the humerus. Lesser tubercle. Present as an elevation on the anterior aspect of upper end. This is the upper end, and this is anterior aspect, and this is the lesser tubercle towards the medial side. Greater tubercle. An elevation that forms the lateral part of the upper end. Now this is the medial part of anterior surface. This is the lateral part of anterior surface. Lateral part forms the bony elevation that is called as the greater tubercle. The elevation on the medial side that is called as a lesser tubercle. The posterior aspect of the greater tubercle is marked by three impressions. As you can see, this is the posterior surface of the greater tubercle. It is three impressions: highest, middle, and a lowest impression. These three impressions provide muscle attachment. Intertubercular sulcus or bicipital groove. This is lesser tubercle. This is greater tubercle. In between greater and lesser tubercle, there is a depression or groove, or you can say sulcus. So this is called as an intertubercular sulcus. In between two tubercles, there is a gap, or there is a groove or depression or a sulcus that is called as an intertubercular sulcus, which separates greater tubercle from the lesser tubercle. It has three parts: two lips and floor. This is the lateral lip, this one, and this is the medial lip, and this is the floor of the intertubercular sulcus. This is medial lip. This is the other picture. You can see lateral lip, and this is forming the floor. Surgical neck. A narrow line separates the upper end from the shaft. You can see immediately below the expanded upper end, there is a narrow construction highlighted in green. This is called as a surgical neck. This was the anatomical neck, and this narrow construction immediately below the upper end, there is a narrow construction. This is called as a surgical neck of the humerus, which separates upper part from the shaft of humerus. Anatomical neck was separating head of the humerus from the rest of the upper part of the humerus. Body or shaft are rounded in upper half and triangular in lower half. As you can see, this is upper half, anterior, posterior, medial and lateral. Every aspect you can see, this upper half is sort of rounded. And in a lower half, you can see this is triangular in shape. It consists of three borders and three surfaces: anterior border, medial border and lateral border. Three surfaces: the anterior medial surface, anterior lateral surface and posterior surface. First we will discuss border. Anterior border, the upper 1/3 is formed by the lateral lip of the intertubercular sulcus. You can see this is the lateral lip of intertubercular sulcus. This is the medial lip of intertubercular sulcus. Now anterior border of the humerus is its upper 1/3 is formed by the lateral lip of intertubercular sulcus. In its middle part forms the anterior margin of deltoid tuberosity. The deltoid tuberosity is actually present on the anterior lateral surface, but this anterior border limits that deltoid tuberosity. This is the V-shaped deltoid tuberosity. This is the anterior lateral aspect, and the anterior tubercle just anterior border just limit the deltoid tuberosity. And this is the lower end of the anterior border. This is the middle end of the anterior border. Now in the lower half, it is smooth and rounded. You can see this is smooth and rounded in its lower half, which continue to end in between the coronoid and radial fossa. As you can see, this is the upper end and this is the anterior border at the shaft, and this is limiting this V-shape deltoid tuberosity, and then it comes down and it is rounded at its lower part, and it ends, this is all over the anterior border, and it ends at the lower end in between two fossa. Borders. Lateral border. Now number 2 is the lateral border. The upper end is formed by the posterior end of the greater tubercle. Now this is the greater tubercle. This is the posterior aspect, and that side will be the medial tubercle. Now it starts from the lateral end. Posterior end. This is the posterior end of the greater tubercle. It starts from the posterior end of the greater tubercle, comes down. This is the middle part of the greater tubercle, middle part of the lateral border, which is not like clear, but it is sort of, you can say the it's not clear. In the middle part, it is interrupted by the radial groove or a spiral groove. This is the radial groove or spiral groove which interrupt this border. And then prominent only at the lower end. This is the lower end. This is the lower end. This is prominent at its lower end. Now lateral borders start from the posterior end of the greater tubercle. It's at the middle. It is not clearly defined. It is ill-defined in the middle or middle portion or shaft of the middle of the shaft, and it is interrupted by the radial groove. This is the radial groove which is actually present on the posterior surface and which crosses the lateral border. So it interrupted by the radial groove or spiral groove, and the lower border is more clear or prominent. It forms the lateral supracondylar ridge. This is the lateral condyle. This way will be the medial condyle. Above the lateral condyle is a sharp margin that is called the supracondylar ridge, lateral supracondylar ridge. Here will be the medial supracondylar ridge. So lateral supracondylar ridge is formed by the lateral border. So again I repeat, the lateral border start from the posterior end of the greater tubercle. At the shaft it is ill-defined and it is interrupted by the radial groove. At its lower end it is more prominent and formed by the supracondylar ridge. Medial border. Upper part forms the medial lip of the intertubercular sulcus. Now this is the lateral border which forms the upper part of the anterior border. This is the medial lip of intertubercular sulcus that forms the upper part of the medial border. Now it continues below with the medial supracondylar ridge. This is the middle part of the lateral border or medial border, and this is the medial condyle, and this is the medial supracondylar ridge. So lower part is formed by the medial supracondylar ridge. Similarly, the lateral border's lower part was formed by the lateral supracondylar ridge. So in the medial border, the lower part is formed by the medial supracondylar ridge. Surfaces. Now anterior-lateral surface lies between the anterior and the lateral border. Now, you can see this is the greater tubercle. This is the greater tubercle, and this is the lesser tubercle. This is the intertubercular sulcus. This is the lateral border which forms the upper part of the anterior border. Now this is the anterior border, and this is the lateral border. Posterior end of the greater tubercle. From the posterior end of the greater tubercle, and at the lower end it forms the supracondylar ridge, lateral supracondylar ridge. Now this surface which is in between the anterior and lateral border, this is the anterior lateral surface. Behind the deltoid tuberosity, radial groove is present. Now radial tuberosity, behind the radial tuberosity there is a radial groove which crosses the lateral border, which is actually present on the posterior surface, which crosses the lateral border. When we were discussing the lateral border, it was interrupted by the radial groove. Now radial groove interrupt the lateral border, and just behind the deltoid tuberosity, the radial groove is present. Upper half is marked by the V-shaped radial tuberosity. This is the V-shaped radial tuberosity. This is V-shaped radial tuberosity, which is present in upper half of the anterior lateral surface. Anterior medial surface lie between the anterior and medial border. Now this is the lesser tubercle and this is the anterior lip of the lesser tubercle, which forms the upper part of the medial border. Now this is the medial border. This is the lateral lip of the intertubercular sulcus and this is the anterior border. Now this surface in between the anterior and medial border. This is anterior border, this is medial border. The surface in between anterior and medial border is the anterior medial surface. The anterior medial surface is upper 1/3 is narrow and forms the floor of intertubercular sulcus. As you can see, intertubercular sulcus, floor of the intertubercular sulcus is formed by the upper part of the anterior medial surface, which is narrow, and it comes down, it gets little broader as compared to the upper part. Now nutrient foramen is present on this surface. As you can see, highlighted in a red circle, this is nutrient foramen, which is directed downward. That means the growing end of the humerus is upper end. The nutrient foramen is always directed opposite to the growing end of the bone. Posterior surface lie between medial and lateral border. This is the medial border. This is the lateral border. In between the medial and lateral border, this surface is the posterior surface. As we already discussed, the medial border starts from the medial lip of the intertubercular sulcus anteriorly, and then it comes down and it forms the upper part of the medial supracondylar ridge. And the lateral border is formed by the posterior. This is the greater tubercle. Posterior end of the greater tubercle, it comes down and it forms the lateral supracondylar ridge. So this is medial and this is lateral border. In between medial and lateral border, there is a surface that is called as a posterior surface. So middle 1/3 is crossed by the radial groove. As we already discussed, this highlighted in a red rectangle, this is the radial groove. So I already discussed, radial groove is present in the posterior part, which crosses the posterior surface, and across the lateral border it comes little anteriorly. So lateral border was interrupted by the radial groove, and at the anterior lateral surface, this posterior to the deltoid tuberosity, it ends on the anterior lateral surface. Now it will be more easier to make you understand like that. Suppose this humerus is a triangular, roughly triangular. This is the anterior border, and this is the medial border, and this is the lateral border. Now this is the anterior medial surface, this is the anterior lateral surface, and this is the posterior surface. Now anterior border starts from the lateral lip of the intertubercular sulcus, and it ends in between the lower part, in between two fossa, ridge in between two fossa. Now the medial border starts from the medial lip of the intertubercular sulcus, and it's from the lower part or ends at the medial supracondylar ridge. The lateral border starts from the posterior end of the greater tubercle. It's a middle part, it is ill defined, and it's a lower part, it's a more prominent, and forms the a lateral supracondylar ridge. And this is the anterior lateral surface, this is anterior medial surface, this is the posterior surface. The posterior surface is marked by the radial groove. The anterior lateral surface is marked by the V-shaped deltoid tuberosity, whereas the anterior medial surface is marked by the nutrient foramen. Lower end. Lower end forms condyles like medial condyle, and this is not actually medial condyle, this is medial condyle, this is medial condyle, and this is the lateral condyle. This is anterior aspect and this is the posterior aspect of the lower end. So medial condyle and lateral condyles, which is expanded from side to side. A lower end, you can see from side to side it is expanded. It has a articular and a non-articular parts. Like capitulum is the articular part, and this trochlea is a articular part. Lateral condyle and medial condyle are non-articular parts, whereas these fossa are non-articular parts. On the posterior aspect, this is the capitulum, superior, anterior and inferior surface. This is the posterior surface of the capitulum. This is posterior surface of the capitulum, which is non-articular. And these condyles are non-articular. This fossa is non-articular. So, only these two parts are articular. Rest of the anterior and posterior part are the non-articular. This is articular posteriorly and these two are articular anteriorly, capitulum and now lower end. The trochlea is a pulley shaped surface, articulates with the trochlear notch of ulna. This is trochlea, pulley shaped trochlea present on the medial side of the lower end. This is trochlea, which articulates with the trochlear notch of the ulna. So medially, ulna will articulate at the trochlea. Medial epicondyle. Medial epicondyle is a prominent bony projection on the medial side of the lower end. This is medial epicondyle, which is a bony projection which is present onto the medial side. This is the medial supracondylar ridge. Lateral epicondyle smaller than the medial one. It is anterior lateral apart. It has muscular impression. This is the lateral epicondyle as compared to the medial. It is smaller. It is a muscular impression. Lateral supracondylar ridge. Superior to that, this is the lateral supracondylar ridge, which forms the lateral border, formed by the lateral border. Medial supracondylar ridge is a sharp medial margin just above the lower end, and the lateral. This is the lateral supracondylar ridge above the lateral condyle, and this is the medial supracondylar ridge above the medial condyle, epicondyle. Coronoid fossa and radial fossa. Now the coronoid fossa, this is the coronoid fossa. This is the radial fossa. Now depression above the anterior aspect of trochlea. This is the trochlea. This is the above the trochlea on the anterior surface. Above the trochlea on the anterior surface of the lower end, there is a depression that is called as a coronoid fossa. Accommodates the coronoid process of the ulna when elbow is flexed. When elbow is flexed, this is the trochlear notch, this picture above, and this is the Olkernen process, and this is the coronoid process. This coronoid process fits in the coronoid fossa when arm is flexed, and this trochlear notch occupies this trochlea. When arm is extended, this coronoid process reaches up till here, but when arm is flexed, this fits within the coronoid fossa. Now the radial fossa, depression above the anterior aspect of the capitulum. Now this is the capitulum, this is the anterior aspect. Just above the capitulum there is a fossa or depression that is called as a radial fossa. It accommodates the head of the radius when elbow is flexed. So radial head of the radius, when it is extended, it normally reaches up till here, but when it is flexed, it comes forward and gets fit within the radial fossa. This is the head of the radius in picture above. Now, Olkernen fossa, this is the Olkernen process. This is the Olkernen process of the ulna, and this is the Olkernen fossa of the humerus on the posterior aspect. Now, this part of the Olkernen process fits within the Olkernen fossa when arm is extended. Lie just above the posterior aspect of the trochlea. This is the trochlea. This is the posterior surface of the humerus. Just above the trochlea there is a depression that is called as a Olkernen fossa. Accommodates the Olkernen process of ulna when elbow is extended. This is the Olkernen fossa process, and this is the when arm is flexed, it fits within the fossa, and arm is extended, then Olkernen process fits within the Olkernen fossa. Side determination. The upper end is rounded to form head. Now first you should know if you are holding the bone is like it's not upside down. It is in anatomical position. So this is the upper end. You should not hold this down. So it should not be upside down. So upper end is rounded from head, and lower end is expanded from side to side. As you can see, this is the lower end which is expanded from side to side and flattened from backward before. As you can see, this is flattened from backward before. These are the 2 points. This is how you will hold the bone correctly, not upside down. And the second point of for the side determination, the head is directed medially, upward and backward. As you can see, this is the head that is directed medially, upward and slightly backward. The fourth point is lesser tubercle projects from the front of upper end. The lesser tubercle, this is the lesser tubercle. This should be medially on the anterior aspect, and the lateral tubercle should be laterally on the anterior aspect. So if this I will hold in my right arm and I'll try to fit on my right side, that will be this will go posteriorly. This region will go posteriorly. So that means I'm holding it not correctly. So this is the, if I'll hold it in my left arm, then it will fit properly and this will come anteriorly, this surface. And number 2, the anterior surface is 2 fossa, whereas the posterior aspect is a lower end, is a 1 fossa. This is the anterior lateral lip of the intertubercular sulcus. This is the anterior border. Anterior lateral lip of the intertubercular sulcus. This is the anterior border, and it separates these fossa, 2 fossa. This is the lateral lip, medial lip of the intertubercular sulcus. This is forming the medial border. and down it forms the supracondylar ridge, medial supracondylar ridge. This is the greater tubercle, and this is the posterior end of the greater tubercle, which forms the lateral border all the way down, which is ill defined at the middle and more pronounced at the lower end, and forms the lateral supracondylar ridge. Now this is the anterior medial surface, this is the anterior lateral surface, and behind will be the posterior surface. So anterior surface lie in between the anterior border and medial border. The anterior lateral surface lie between the anterior border and lateral border. Posterior surface lie between the medial border and lateral border. Anterior lateral surface is marked by the nutrient foramen. Anterior lateral surface is marked by the deltoid tuberosity in its upper half, where the posterior surface is marked by the radial groove. This is the body, this is arm, this is how you can see, this is the anatomical position of the humerus. Here you can see this is the surgical neck, this yellow is the anatomical neck, lateral tubercle, medial tubercle, lesser tubercle, greater tubercle, intertubercular sulcus. This is floor, this is the anterior medial surface. Lower end, olecranon fossa, greater tubercle, lesser tubercle, trochlea. Here you can see capitulum, trochlea, pulley shape, and which receive the ulna. This articulate with the radius. This is the radial fossa, this is the coronoid fossa, this is medial tubercle, this is lateral tubercle. This is a lateral supracondylar ridge, this is medial supracondylar ridge, this is anterior surface, this is anterior border. This is posterior surface, this is lateral border, this is medial border. Again, lateral border, medial border, lateral border. In between medial and lateral border, this is the posterior surface. This is marked by the radial groove. Here you can see this is the medial border. This is the anterior border. In between these two, this is the anterior medial surface. And this is the lateral border, and this is the anterior border. In between these two is the anterior lateral surface. Clinical anatomy. Arteries and nerves liable to damage at four sides of the fracture in the humerus. In the humerus, there are four common sites for the fracture. Number one is the fracture at the surgical neck. This is the surgical neck, as we already discussed, which divides the upper end from the shaft. So surgical neck, when the fracture of surgical neck occurs, the potential damage of the axillary nerve and posterior circumflex humeral artery, they both wind around the surgical neck. If the fracture occurs, these both can get damaged. Then midshaft fracture. If the midshaft fracture occurs, the potential damage to the radial nerve and profunda brachii artery, they goes posterior to the midshaft. When the fracture of the medial epicondyle occurs, potential damage to the ulnar nerve and the ulnar collateral artery, they both passes posterior to the medial epicondyle. Fourth is the supracondylar fracture. This is the lateral condyle, this is the medial condyle, this is the supracondylar part. If the supracondylar fracture occurs, which is most common in children, because this part is weaker and thinner in the children. So potential damage to the brachial artery and median nerve occurs because they cross anteriorly to this supracondylar part. So most common site for the fracture in humerus are the fracture at the surgical neck, midshaft fracture, supracondylar fracture, and fracture of the medial epicondyle. So they are related to the different nerves and arteries. They can get damaged if the particular fracture occurs. References are BD Churasia and Google. Thank you.